pharmaceutical options. What drugs do we have available, and what are all the side effects, and how do we address all that? And then we're going to talk about surgical pain management, like in cases of painful pets. Surgery can actually address the problem. And then finally talk about non-traditional pain management approaches. So on your first 2 pages, I have given you charts on the various physical indicators of pain in cats and dogs. What I particularly like is the vocalization. They can do any one of those things. Whine, cry, or not say anything. How many golden retriever owners do I have in here? Yeah? Or people that know golden retrievers. Or Labradors. The happy, bouncy, stoic dogs that are like, life's good as long as you're feeding me, right? They may not tell you that they're painful. So it's our task to look at subtle signs like, when they go to bed at night, are they just laying there panting instead of sleeping soundly? Or what about having a hard time getting comfortable? Like, your dog normally circles 3 times and plops, but now suddenly he's circling once and just kind of, it's hard to get down. That's a dog that's probably painful. So we have to start looking at behavioral trends, both what's normal, maybe when they're a young, energetic animal, and maybe as they're aging. We've also got attitude. One of the things that I thought was really interesting that I saw for cats is when they're here in the clinic, posture really changes. The whiskers go back, they arch their back, they hunker down, they may be in the back of the kennel. Now, of course, what I see here is a very different pet. How many of you have said, oh, my pet's painful at home, and then they come in and they act like nothing's wrong? It's like taking your car to the mechanic. They never do it here. And that is totally normal, we expect that. So we rely really heavily on owners to report signs of pain. I cited a couple studies on the second page with cats. A study in 2012 basically said that no signs of pain were elicited in a physical exam, and that cats with osteoarthritis had to be identified based on the owner's history and signs reported by the owner. That most of these patients we couldn't identify signs of pain because cats are so good at hiding pain. This is a fight or flight response mechanism. It behooves them to not tell us that they're painful. There aren't that many pets, cat or dog, or heck, people that like to go to the doctor, right? It's not a popular thing to do. So a lot of times, they hide everything. So it's going to be particularly important for you as owners to be mindful of that. And then another study, 92% of randomly sampled cats at a private vet clinic. This is not a teaching hospital where they get the worst cases. This is a private vet clinic. 100 cats examined. 92% of them had radiographic evidence of arthritis. That's terrible. And so if we're not identifying sources of pain, we are doing our pets a tremendous disservice. Now the question is, okay, how do we go about doing this? How do we find these? Well, that's where these charts come in. Every pet's different. It's going to be a real issue of, okay, identifying baseline. What does normal look like in a happy, energetic patient with no known trauma? So as you run down these, are there any that you have questions about? Any that speak to you, or you're like, I don't know about that? Just look through them really quickly if you're a cat owner or if you're a dog owner. And then see if there's anything that you have questions about before I move on. While we're at it, who are my cat owners? Okay. I'm going to give you the Colorado State Pain Scale. This is what the doctors use to assess surgical or post-operative pain. I don't expect you to do this, but it's a really nice list, and it's got pictures of what it should look like. Cat owners, in there. Actually, just pass them around. If we need more copies, I'll make more. And then dogs. I know you need one for the dogs. And if you run out of the cats, just let me know, we'll make more copies. Alrighty. Did anybody have any questions as they were running through those charts and the indicators of pain? Do we need another copy of the cat?
Yeah.
Okay.
Picture the dog.
No dog. Yep, pass the dogs down. sorry. There we go. Laura, let me grab one of the cat ones. Stephanie, I'm gonna grab this and make a quick phone.
She needs a dog though.
There we go. We'll get them all out. We knew this was gonna be a lot of dog owners. We anticipated. So as we ran down that list, we need to get him. Did anybody have any questions about those?
I just have a question, I don't know if there's pain involved or not, but Comet, who's my very submissive Aussie,
Right.
she lost the two dogs that she got along with best
Mhm.
over a 4-month period.
Right.
And she's quieter and, I don't know, just more submissive and frightened and.
Do you want to scamper out? She's yelling. Has she been in all day?
Yeah.
Okay. Speaking of, Scamper's a really good example. Scamper's one of our hospital cats. She's almost 17 years old. She was born here.
She didn't have a, she was born here?
She was born here. Now she's almost 17. Go ahead and set her down more. She can just go ahead and walk around. You'll see her move. She is definitely a cat who walks like she's stiff. If you watch her walk, she's all stiff in the back end. I have taken x-rays of this cat on multiple occasions. She's not fine because she's clearly painful, but for the life of me, I can't find sources of pain. But that doesn't mean I'm not going to treat it. So she is on pain management, even though I'm not sure why she's painful. But if you see somebody walking around with her back hunched and they're all stiff in the back end, who's throwing their back out? Is anybody here throwing their back out? It's miserable, right? Dr. Burbrink. Yeah, Dr. Burbrink does this at least once a year. But if you watch somebody, even if you took x-rays of them, you wouldn't see anything wrong, but it hurts, right? So we treat appropriately. So she's a good example. So she's right now, she's been locked up all day.
And she's so thin compared to mine. Mine is obese like her mother.
Yeah. When Berkshire moved in, everybody went on a diet. I'm the calorie Nazi here. Anybody who's been my patient has heard the lectures. So, okay. She's losing a lot of muscle mass. She's 17. So she's losing a lot of muscle mass. So we're good on this part? Okay. I want to talk about sources of pain. Because we are on page 2. Pain comes from a lot of different places. Not just individual sites like my knee. We're going to talk about the general body systems that contribute to pain. The first being the most widely recognized, which is skeletal pain. And as part of skeletal pain, we're going to talk about joints, ligaments, tendons, arthritis, that kind of stuff. Skeletal pain, I'm just grouping anything that relates to bones. Now, how does that work? There are nerve endings in the actual bones. That's part of it. There are nerve endings in the tissues around the bone, so that relates to it. And then there's the whole inflammation thing. Who here has arthritis? I'm pretty sure you do. I've heard your knees. Yeah, and so, I mean, it happens, right? But why does arthritis hurt? Arthritis hurts because there's inflammation at the site. That inflammation, all those cells that are saying, ah, that's quite literally what they're doing. They are releasing inflammatory chemicals that then stimulate nerve responses. So then we've got joint pain. That's a whole new thing. The more inflammation that occurs, the worse it gets. And it actually causes erosion of the joints. The inflammation itself, while it's painful, is also actively damaging the joints. And so that's a big thing to remember, is that it's not just, oh, it hurts, it's also causing progressive damage. So that's a big deal. Degenerative joint disease and arthritis all grouped together. Fractures, obviously. Your dog breaks a bone, it hurts. Your cat breaks something, it hurts. That is the easiest thing to recognize. I didn't put it on here, but like dislocated joints. Dogs dislocated hips, dislocated digits. We one kitten tried to climb up his kennel and turned and got his toe caught. He dislocated his toe. He was not a happy kitten. But those are easy things. We know that there's usually a history of trauma. Joint disease sneaks up on us. And it can sneak up on us way too quickly, too. And then cancer. cancers of the bone. This is a dog that might seem really young. We don't see it very often in cats. This is really rare in cats, so I'm going to specifically focus on dogs. Cancer of the bone is bad. It is incredibly painful and it sneaks up on us. And you may not notice anything other than the dog's like, don't touch me. And it is usually screamingly painful. But you won't notice anything externally. So that's tough. But usually it's an acute pain, it's a severe pain. The ones that are hard are these insidious ones. Tick-borne disease. Lyme disease is so prevalent. Between 2009 and 2010, the number of human cases in Virginia went up 40%.
Wow.
It might be, A, are we getting better at diagnosing it? Or B, are we actually getting more of it? And it does appear that the ticks are coming down. So Lyme disease originated in Lyme, Connecticut. The ticks that carry it, we're seeing a whole migration of the disease. We're also getting Gulf Coast ticks from Texas that are bringing up Babesia and other tick-borne diseases. Ticks are disgusting. They carry up to 36 different diseases, and many of these diseases can look like autoimmune diseases. They're really tough to diagnose and cause a lot of inflammation that can go anywhere. Anybody known a person with Lyme disease? It's bad. Fortunately, our dogs are a bit better at dealing with it than humans, but we need to be really mindful of it because, again, it sneaks up on us and it is painful. I'm going to group, yes?
Well, on the ticks, do the drops that we put on there, whatever it's called,
Right.
does that protect them from the disease or not?
It does not. It protects them, it prevents the ticks from attaching long enough to hopefully
Right.
transmit it. In theory, it takes about 36 hours of attachment for a tick to transmit sufficient bacteria to cause Lyme disease. And the drops are supposed to kill the tick in 24 hours, typically. Nothing's perfect. And so that's why we started doing the Lyme vaccine, because it's bad. In 2010, we ran the numbers, and between January and March, 12% of our canine patients tested positive for Lyme disease. We have excellent clients here who routinely put on their flea and tick preventatives. It still happens. Cats, again, really good at not getting this. A, their grooming behaviors are phenomenal at getting ticks off of them. B, many cats are predominantly indoors. And C, I think that there's something with their immune system that they're just less susceptible to it. So, tick-borne diseases often emulate autoimmune disease where the immune system might be attacking it. And then we get to tendon and ligament damage. Cruciate tears. It's very similar to an ACL tear in a human. They hurt, and what happens is with the knee, normally it just flexes like this. With a cruciate tear, we get this kind of action, and rubbing back and forth causes inflammation at that joint. There are so many different things. There's also congenital disease. There's a laundry list, but skeletal pain is an easy one for us to figure out, generally speaking. Then we start talking about nerve and visceral pain. Fibromyalgia in humans is a big hot button pharmaceutical topic. Every time you turn on the TV, there's an ad for Lyrica or something else. Like, nerve pain is a really big deal because it's hard to treat. It's hard to identify. It's really easy for a human to walk into their physician and say, I'm having tingling pain up my arm or down my leg. How do our dogs or cats tell us that? And because they may not be limping, they may just be suffering. We might not notice anything more than just withdrawal. That's a tough one. So nerve pain is a hard one for us to diagnose. The options for diagnostics for nerve pain are pretty limited. EMGs. Oh yeah, they'll actually put electrodes and they'll try and stimulate the nerves, or they'll monitor the electrical activity of the nerves. That means I have to send you to a neurologist, and they may or may not have diagnostic tests. That's a tough one. Then we've got the obvious, like spinal pain. Okay, you herniated the disc, and now you go, that one I can handle. That one we usually have a history. But then we've got sneaky ones, nerve-based tumors, post-operative pain. Whenever we cut the skin, there are nerve endings in the skin. It may not be bruising or inflammation, it might just be that those nerve endings are firing. So there's different techniques for addressing that. In really advanced surgical cases where we know we're going to have a lot of pain, they'll actually put little catheters in the incision to slowly infuse morphine derivatives directly at the site. And then we've got like visceral pain. That's like